Family Lifeline, a tool that summarizes the history of the family's significant experiences over a period of time in a chronologically sequenced manner. Useful when anticipating a long-term illness, the presence of difficult caregiving, non-adherence to treatment strategies. Interpretation is based on the most significant event that affected the health of each member or influenced the health-seeking behavior or perception on health of the individual or the family. It includes normative and non-normative crises. Normative, these are predictable, age-related challenges and transitions that are considered normal parts of development. They are expected to occur within a certain time frame, and most people experience them. Starting school, puberty, graduating from school, getting married, having children, retirement, death of elderly parents. Non-normative, these are unpredictable, unexpected events that disrupt a person's life. They are not tied to a particular stage of development and can happen at any time. Sudden job loss, serious illness or injury, death of a child or young spouse, natural disasters, accidents, winning the lottery. Yes, even positive events can be non-normative and require adjustment. It is sometimes placed side by side with the illness history. It helps process how flexible a family is when dealing with these changes. Family Scream. Assessment of the family as to its capacity to participate in provision of healthcare or to cope with crisis. SCREAM is an acronym that stands for social, cultural, religious, economic, educational, and medical factors affecting health. It is commonly used when the need for care is long or lasts a lifetime, such as in the case of chronically ill, terminally ill, and hospice care patients. It can also be used to assess resources of difficult and non-compliant patients. If there's a lack of resources, it can also serve as a kind of pathology in certain situations. Social. Resources. Social interaction is evident among family members. Family members have well-balanced lines of communication with extra-familial social groups such as friends, sports, clubs, and other community groups. Pathology. Isolated from extra-familial, problem of overcommitment. Cultural. Resource. Cultural pride or satisfaction can be identified, especially in distinct ethnic groups. Pathology. The family has feelings of cultural, ethnic inferiority or shame. Religion. Resources. Religion offers satisfying spiritual experiences as well as contacts with an extra-familial support group. Pathology. Dogma and rituals are so rigid that they limit the family's problem-solving capacity. Economic. Resources. Economic stability is sufficient to provide both reasonable satisfaction with financial status and an ability to meet economic demands of normative life events. Pathology. Financial problems make it difficult for the family to meet monetary demands of crisis or illness. Economic deficiency. Inappropriate economic plan. Education. Resource. Education of the family members is adequate to allow members to solve or comprehend most of the problems that arise within the format of the lifestyle established by the family. Pathology. Limit the ability of family members to comprehend the problem or recommend solution. Medical. Resources. Medical care is available through channels that are easily established and have previously been experienced in a satisfactory manner. Pathology. Inaccessible and underutilized. Family adaptability and cohesion evaluation scales. FACES. FACES 4 is the latest version of a family self-report assessment designed to assess family cohesion and family flexibility, which are the two central dimensions of the circumplex model of marital and family systems. The 6 family types range from the most healthy and happy to the least healthy and most problematic. They are balanced, rigidly cohesive, mid-range, flexibly unbalanced, chaotically disengaged, and unbalanced. The previous version of the circumplex model allows for analysis of families who could be categorized as balanced, unbalanced, or mid-range. This new typology will allow for the comparison of the 6 different family types regarding a wide variety of criteria and variables. Cluster 1. Balanced is characterized by the highest scores on the balanced subscales of cohesion and flexibility, and the lowest scores on all of the unbalanced subscales, except for rigidity, where the scores are near the lowest. This combination of high balanced and low unbalanced scores indicates a family type with high levels of healthy functioning and low levels of problematic functioning. These families are hypothesized to be able to best handle the stressors of daily living and the relational strains of changes in the family over time. This family type is the least likely to be seen in therapy. Cluster 2. Rigidly cohesive is characterized by high closeness and rigid scores, moderate change and enmeshed scores, and low disengaged and chaos scores. This family type has as its hallmark high degrees of emotional closeness and high degrees of rigidity. This family type would be hypothesized to function well at times given their high degree of closeness. However, they may have difficulty making the changes required by situational or developmental changes due to their high rigidity. Cluster 3. Mid-range is characterized by moderate scores on all of the subscales, with the exception of the rigid subscale. This family type would be hypothesized to function adequately, displaying neither the high levels of strength and protective factors tapped by the balanced subscales, nor the high levels of difficulties or risk factors tapped by the unbalanced subscales. Cluster 4. Flexibly unbalanced cluster is characterized by high scores on all of the subscales other than cohesion, where moderate to low scores are characteristic. The high scores on the unbalanced subscales, combined with the low to moderate scores on cohesion, would seem to indicate problematic functioning. However, the high scores on the flexibility subscale may indicate that these families are able to alter these problematic levels when necessary. Cluster 5. Chaotically disengaged is characterized by low scores on the balanced subscales, low scores on the enmeshed and rigid subscales, and high scores on the chaotic and disengaged subscales. These are hypothesized to be high problem families based on the lack of emotional closeness indicated by the low closeness and high disengaged scores, and the high degree of problematic change indicated by the high chaos and low change scores. Cluster 6. Unbalanced is almost an act mirror image of the balanced family type. The unbalanced family type is characterized by high scores on all 4 of the unbalanced scales and low scores on the 2 balanced scales. These families are hypothesized to be the most problematic in terms of their overall functioning.